All right, so we've got our aligner created from the positive pressure machine, and so now we're going to actually separate the aligner from the model. This is a situation where the gingiva there's not a whole lot of gingiva, so we have to be kind of careful. Getting a saw in there is going to be tough. You could use a hot knife, you could use various other things to do this cut, but we're going to use a little saw on our lab handpiece. But since I have difficult access, I'm actually going to use some fairly tough scissors. They're small, but they're pretty strong. So bring this down. No specific pretty way of doing this, just trying to get rid of this excess. So now I can take my saw, which you can get from most of your distributors, supply reps, or most of the online ortho companies. All right, so I'm going to turn it on, and I'm going to use this, and we're going to go ahead, and I'm going to probably aim about 2 to 3 millimeters below it, and then I'm going to cut right into the model. Go around. I'm going to dial up this speed because it's a little too slow. Kind of bogging down a little bit. And honestly, I'm not the one that usually does this. This is usually something my assistants do. But they also don't like being on tape. So, and I'm just that vain that I love it. Separated. And by staying a couple millimeters away, you can always go do another one, and you're not gonna, if the patient loses it or whatever, you haven't hurt the teeth, you haven't done anything. You're very unlikely to break teeth off of a printed model like you would a stone model. So you don't have to worry about that. And if you've done a good job on your first pass, if you have to make another one, you just follow that same line when you cut them off the next time. I can tell you personally that my own final retainers have been made a couple times because I'm a terrible patient and I like to lose retainers. Alright, so I don't have to peel all this away, but it's a nice way to know if I've got a good clean cut, and I do. Turn this off. Just a little buffalo knife here. Try to get under it, tease it off in a couple areas. Don't want to contort it too much and accidentally warp it. Most of us have probably done this a time or two, so it's pretty straightforward. And I tell patients in aligners it's actually easiest to get the aligners off out of their mouth by pulling up in the lingual anyways. So the same goes for off of the printed models. And we've got some buttons on these teeth, so they're hung up a little bit. So there we go. So the aligner is off, and now we're going to buff it out. In another video I showed how to make some of these buffers by using Scotch pads and just the little screw retain little jigs, but I'll go ahead and just use the one I've got ready here. I'll turn this down. Well, first let's take a look. You'll see that it's all cut out pretty well, pretty evenly, a couple millimeters above. Doesn't take too much time. But now we don't like these fuzzies because the patient's going to hate them, of course. We can't give that to them. So I'm going to buff them out. I'm going to turn this down because that's way too fast. And you can see them start to disappear on us. Now technically, this is actually tray number 1, which is the tray that I would use to put the aligner buttons on, which I can trim away most of the lingual actually, because it's not even going to stay in her mouth. But if you want to use this as a training tray, so the patient can get used to it first, without actually moving teeth, which is becoming more and more common to start that out that way, then you do want to go ahead and smooth this up just like any other aligner. And I'm just just about done. And this is the area that we didn't actually cut because it just went to the bottom of the model. So you definitely want to make sure that it doesn't fit outward or some other weird alignment. And it's fine, but just pay a little extra attention there if you have a spot like that. All right, and I think we're pretty much good. And so now we would pull out our handy dandy little embossed aligner tray, or a little box, whatever. Have a few of them set up and just insert that and give it to the patient. So that's it. All right, thank you very much.